I'm Dr. Brian Campbell, performance physical therapist and hybrid athlete. Welcome to my channel that helps athletes overcome injuries, unlock peak performance, and optimize their recovery. Let's get after it. I'm Dr. Brian Campbell. If you've been dealing with hip pain, I'm going to show you the top 3 exercises you should be doing to make sure you can get rid of that hip pain, whether it's in the front of the hip, the side of the hip, or even the back going into your low back. This 3-step process is going to be very important to make sure you get to become pain-free. So for this first exercise, you're going to need a lacrosse ball, a tennis ball, some type of ball that you can do this glute mobilization with. If you don't have one of these, look in the link below, and we have our best options that we recommend to our clients. So what I'm doing with this first one is I'm going to take this ball and I'm going to place it in 3 different spots. So I'm going to start right high up on my hip. So if you feel your pelvis, that bony part of your hip right through here, you want to be right below it, right by your belt line. We're going to start right in the front of the hip, right behind our back pocket, and then we're going to go right to the side, and then we're going to go right into the back, right by the tailbone, but still stay in the meat of that glute. So I'm going to start in that front spot, and what I'm going to do is I'm just going to get as much body weight pressure as I can tolerate. I'm going to lock that down, and then I'm going to rotate my leg as far as I can. And I'm going to do this about 5 to 6 times. This is a pin and stretch technique. So this is going to help alleviate a lot of stress that occurs from dysfunctional tension that occurs within that hip capsule. After that first spot, I'm just going to slide a little bit into that second spot, do another 5 or 6 rotations. Then I'm going to get to that third spot right by that tailbone. Again, another 5 or 6 rotations, trying to get my knee through as much range of motion as my body will tolerate. Now, even if one hip hurts, you must make sure you do both sides. It only takes about a minute to do this, so make sure you're hitting both hips. Now, the next movement we're going to do is we need to isolate how to get hip extension back. And what we're going to do for that is these sideline kicks. So for this movement, I'm going to lay on my side with my belly button slightly facing towards the floor. Most important, my foot stays above my knee. From this movement, I'm going to drive my foot out, trying to get my leg behind my body. So what I don't want is I don't want this, I don't want this, I want to get back. Think that you're just trying to kick behind you, just making sure that your foot stays above your knee. That's going to create a lot of good tension in that back pocket cheek muscle. Now, if you want to progress this and you want to get some more good input, you can grab one of these longer red bands. Again, if you don't have one of these, we have a link below. And then from here, it's the exact same mechanics, but I'm just holding that band in my bottom hand. That's going to help me drive even more good tension through that back pocket cheek, which is going to help alleviate even more of that tension that causes hip pain. All right, so for this last one, we now need to do something closed chain. That means our foot needs to be connected to the floor to help re-educate our entire lower extremity system on how to use those muscles appropriately. That was a really long way of saying we need to do some single leg bridges. So what I'm doing for this is I'm going to simply lay on my back. I'm going to bring one knee tight to my chest. The working leg, I'm going to keep my foot slightly outside of my body. So if I look down, I should be able to see my foot. My knee stays inside my foot. So we're at the same position as we were for the other drill. From here, I'm going to drive my foot as hard as I can into the ground to get up as high as I can. Now, there's a couple things that can happen. One is that I'm going to shift my body towards my opposite shoulder, which is okay. 2 is that my hamstring might cramp up, which is also okay, because sometimes that hip flexor is so dominant that the glute doesn't know how to fire and the hamstring takes over. But the one thing we don't want to happen is we don't want you to go up and let that knee go out. We want to make sure where your knee starts is where your knee stays through the entire movement that you do. And if you can't keep that knee in, then what you need to do is try to push harder through the inside of the foot to get up as high as your body will let you do. So with these single leg bridges, again, just like the other 2, you want to make sure you're doing both sides. We want to shoot for about 10 to 15 reps on each side with these single leg bridges. We're always looking for quality over quantity. So if you feel that you can't keep your knee in position, your hamstring's really cramping up, you feel your low back, and you can't get that to go away by pushing harder through the inside of your foot, well then that's your time to stop that set. So with the kicks and with the bridges, we want to do at least 2 sets per side. So we're looking for about 10 to 15 reps of each of those movements on each leg. Try that. If you're finding some great relief, but it still isn't gone yet, there's no risk in doing this all over again and doing a whole another set of this protocol. And you could do this 3 or 4 times a day and get that pain to go away pretty quickly if you stay consistent with it. If you are finding relief with this, please let me know. Write a comment below, like, share this video, and most importantly, if you did enjoy the video, make sure you subscribe.